September is Gynecologic Cancer Awareness Month, and we're talking about the symptoms and the misconceptions and what women can do to prevent gynecological cancers. We're joined now by Dr. Eugene Toy, a gynecologist and oncologist at Rochester Regional Health. Good morning, doctor. How are you?
Good morning.
I think this is, one of those things where, it could fall by the wayside, where people can ignore the signs and thinking, I'm not really seeing any symptoms on the surface, so everything must be fine. And as an example of if you neglect your health, it could lead to further problems down the road. I want to ask, what are some symptoms that women should be looking out for that could signal that something's not right and you need to see the doctor?
Yes. Well, the most common gynecologic cancer, particularly in the menopausal years, is uterine cancer, cancer of the womb. And this usually presents with postmenopausal bleeding. So until proven otherwise, really that should prompt attention brought to their primary GYN or to source a specialist such as myself, a GYN oncologist.
Yeah.
Other non-specific complaints such as abdominal pain or bloating or feeling a sense of early fullness, what we call early satiety, could be a very insidious onset of ovarian cancer, which is not the most common gynecologic cancer, but is the most lethal.
Mm-hmm.
And that really requires attentiveness to these symptoms that to me have persisted, have progressed, and really have no explanation.
Yeah, and there are preventive ways that women can take to really get their health in check, and talk about some of those preventive measures that are in place that women should do once a year, in fact, just to make sure that everything's okay.
Yes, while we have really done such a wonderful job with screening for cervical cancer and vaccination for the HPV virus, we know that women should still see their gynecologist or their primary care provider that would be able to do a pelvic exam annually, and really to offer any changes in their pelvic health or some of these abdominal complaints, which might be very commonplace and indicative of other digestive problems, but could also be indicative of a serious problem such as a gynecologic cancer.
Sure. What are some misconceptions or things you hear from patients why they don't get to the doctor sooner?
I think, some of the abdominal pain or intolerance of food, people think, oh, it's just related to my digestive tract or irritable bowel syndrome. We know that that's the more common diagnosis, but if this persists and really no explanation and is getting worse, I mean, these are potentially red flags that something more serious can be going on, particularly with relation to ovarian or other types of gynecologic cancer.
If anything, no matter how small the discomfort level might be, or if it's just anything, you should just talk to your doctor and check in, because as you mentioned, that the diagnosis could lead to something else being discovered, or preventing this from becoming worse.
It has been very difficult during this COVID pandemic, and our job as providers is really to educate, to really advocate for our patients to seek attention and to be accessible. And now with telehealth medicine, we really can have a very safe virtual visits, and some of these complaints can come to our attention immediately.
Yeah, absolutely. Dr. Toy, thank you for those reminders. When in doubt, just check with your medical provider. Thanks for your time. Weather and local headlines are coming up next.